Optometry is a 4-year program, and we think it's important to have a 4-year clinical experience. So starting within the very first few weeks of matriculation, our students go out into the community and start providing visual screenings for elementary school-age children.
Good job. Can you tell me what this one is? Yeah, good job. This one?
In doing so, they not only have an opportunity to immediately start applying some of the skills they may have just learned in the classroom, but they're also providing a valuable service.
Way thicker, it's almost close to neutral, yeah?
Right.
What if you go up 1 to 2, 5?
I would say it's opposite.
Yeah? All right, let's go down.
They continue the vision screenings throughout their first year, in addition to then adding some observations where they go out into the community and observe more experienced doctors and how they interact with patients.
You might have had something that scratched a little bit, and now as it's healing, it's giving us a little bit of this type of pattern we're seeing.
This then continues to evolve in their second year and are assigned to a more traditional clinical environment, caring for patients in the community.
10 seconds, okay? Good. 1, 2, 3, 4.
The first patient that I saw in my second year was an 18-year-old girl that was her first eye exam. She really didn't know that her vision was that blurry. And then just giving her glasses, which seems like a simple thing, but actually doing a proper refraction and getting her glasses,
straight ahead.
It made her see so clear. And when I finished the refraction, which is the phoropter that we use, she didn't really want to look away from it because everything was so much clearer through there compared to what she's used to. So that was actually the first patient I saw, and that was really cool.
Look down, look straight ahead. Great. I'm gonna slowly let go your eyelids, okay? Yeah. Blink. Personally, as a second-year student, I was actually at this clinic working with patients. And then open as wide as you can. That was when I was first introduced to specialty contact lenses. By that second-year point, I knew I wanted to do a residency. So it's interesting because now I'm on the other end of things, precepting students. And Brennan's just gonna put a drop of that yellow dye in through the process of fitting specialty lenses. And I think NECO puts us in a very unique position because we're rotating through a variety of clinical sites. So everything from contacts and pediatrics to ocular disease, we get a good range of it by the time we graduate. So that way, truly, if you do have a passion for one specific aspect of optometry, you're able to explore it and take it to another level with residency.
You want to go with more of like the dry eye, let's tackle that first, and then keep the lenses, okay?
As they continue along in their studies and are learning more and more, the clinical responsibilities increase as well.
And then in his left eye, he's got SPK, central.
This continues throughout their third year, where they now take on full responsibility for providing an eye exam from beginning to end, and then culminates in their final year, where they are in patient care full-time. Boston is a wonderful environment to learn to be a doctor. It has some of the best hospitals in the world. It has the right combination of outstanding universities and clinical facilities to make it an ideal place to train. It's been acquired. And when it comes to fourth nerve palsies, it's really difficult sometimes because in many cases, you either have something that is congenital or very early onset acquired.
As an optometry student, you're rotating through community health centers to being in a hospital setting, in a private practice setting, to even working at a homeless shelter. By the time you graduate, you have a very well-rounded base of seeing a variety of different patients.
So cubre izquierda, aquí.
So the idea that we're able to provide primary care, infectious disease care, diabetic care, behavioral health care, and then moving it on to optometry and eye care is just a very natural thing for us because when you think of the amount of diseases that affect the eyes, even just diabetes, we have 3,000 diabetic patients just in our practice.
Being treated for hypertension, so has signs of diabetic macular edema. We did refer him to ophthalmology, but we just wanted to talk.
And put your forehead right against this headrest there.
We're
Perfect.
always looking at technology and coming up with what the next step is for our students, what the next step is for our generation of optometrists that we're training to propel the profession forward as well as propel our students' education forward.
Can you read that last line for me?
We believe that by providing a clinical experience, they get a real-life opportunity to see how these things they're learning about in the classroom really exist.
I'm going to have you look down for me.
This synergy between the didactic and the clinical education, we think, is the absolute best way to take students and turn them into doctors.